Good afternoon, and welcome to this week's Monroe County COVID-19 briefing. As always, I'm joined by our Public Health Commissioner, Dr. Michael Mendoza. And this week, we're also joined by Dr. Michael Apostolakos, the Chief Medical Officer at the University of Rochester Medical Center, and Dr. Robert Mayo, Chief Medical Officer at Rochester Regional Health. And you're going to hear from all three of them shortly. We've said it now for a few weeks in a row, and this week is no different. Our COVID-19 numbers in Monroe County and in the Finger Lakes region are going up. Our case numbers, our positivity rate, our hospitalization numbers, and our ICU numbers. While we know more about the virus now than we did 7 or 8 months ago, the threat to our community and our public health has not waned. COVID-19 is still here in Monroe County in the Finger Lakes. People are still becoming gravely ill by this virus, and we're seeing it in our rising hospitalization numbers.
Look on what video?
Down to the left.
Dr. Mendoza will go into more detail, but where we are seeing our greatest increase in positivity rates and cases now is with indoor gatherings of large groups of people, whether that's at someone's home, a bar, restaurant, or somewhere else. We are seeing it spread in places of business, so employers, please tell your employees to stay home if they are feeling ill. Our cases are increasing because the colder weather has forced us to use inside locations more. We've seen these increases all across the county, but some areas are seeing their numbers, particularly their positivity rate, go up higher than others. Specifically, we've seen a significant rise in the rate in the zip codes 14612 and 14626 in the town of Greece, 14580 in Webster, and 14609 in Rochester and Irondequoit, and 14450 in Parrington. But here's the good news. We know what works to stop the spread and flatten the curve. We have done it once, and now we need to do it again. Our schools are a great example of this. Those that have been able to open for in-person learning have been a standard bearer on how to stay open in a safe and responsible way to date. Our teachers, staff, students, and families are working so hard to keep everyone healthy and safe, and we must all follow their lead. So what does this mean? We need to be wearing our masks, maintaining good 6 feet of physical distance from people outside your immediate household, and limiting our gatherings with friends and extended family. I understand that can be frustrating, and it's different from what we all got used to when we were able to spend more time outside during the summer months. But we wear our masks so that our schools are able to remain open for in-person learning. We keep a 6-foot distance so that our bars and restaurants are able to remain open. And we limit our indoor gatherings so that we can go to stores and to work. Another important piece of continuing our increase in surveillance through testing. New York State is committed to continuing their testing operation out at MCC. It currently has a capacity to test about 700 people a day and has tested nearly 80,000 people to date. Getting an appointment at the MCC testing facility is as simple as calling 888-364-3065 or visiting the New York State COVID-19 website at coronavirus.health.ny.gov. If you are feeling ill or have been in close contact with a known positive case, we encourage you to take advantage of this free testing location. And even if you're not symptomatic, have not had a known interaction with a positive case, you're still eligible to receive a free test at MCC. You just have to go to the website or call the number and schedule your appointment. We will get through this, we will flatten the curve, and we will do this in a way that keeps all of us safe and healthy. But we just have to go back to the practices that we learned earlier this year and understand what worked and what didn't. And wearing our masks and keeping that distance, we all do this together, recognize we're in this together, we will get through this together. So now I will turn this over to Dr. Mendoza for the health update.
Thank you, County Executive Bello, and thank you to Dr. Apostolakos and to Dr. Mayo for joining us. And as always, thank you to the members of the press for being here today. Today, we are in an unfortunate position. After months of containing the spread of COVID-19 in Monroe County, we are now seeing a second surge. As of right now, we have more than 850 active cases, nearly 3 times the number of active cases we had just 1 month ago on October 5th. Today, we will add about 120 new cases and likely an even greater number tomorrow. The last time we had this many active cases was in mid-June, after reaching a peak of more than 1,100 active cases in mid-May. Thankfully, our positivity rate is not even close to being as high as the rate that it is in other parts of the country, and we are not the highest here in New York State, but unfortunately it is heading very rapidly in the wrong direction. So how did this happen? The answer is simple. As I've been saying for several weeks now, we are gathering. We are going to weddings and parties where we don't always stay 6 feet apart with our masks on. We are going out for drinks with friends or coworkers and not always staying 6 feet apart with our masks on. We are sitting across from one another in break rooms, eating lunch within 6 feet of each other and talking without our masks on. And we are carpooling our kids or one another to practice without wearing our masks and without rolling down the car windows. We are inviting our friends into our living rooms, our dorm rooms, and our apartments, and not staying 6 feet apart with our masks on. And we are going to church and choir practice and not staying 6 feet apart with our masks on. These are the stories behind the growing number of cases. Yes, we have some clusters in colleges and in other places, but for the most part, these active cases are not part of a known cluster. In short, too many of us have simply stopped doing what we know works. And that is taking its toll. We now have community spread. It is now safe to assume that if you are going out in public, there is a chance you could be exposed to COVID-19 if you do not take proper precautions. This is not a place we want to be for many reasons. Among the most critical is the detrimental impact a spike in COVID-19 cases will have on our healthcare systems and the health of our community. For that reason, I've invited Dr. Apostolakos and Dr. Mayo here today to talk about the impact on the healthcare system and on their patients in particular. Dr. Apostolakos?
Thank you, County Executive Bello, for this opportunity. And as always, it's a pleasure to be here with two of my colleagues, Dr. Mendoza from the Health Department and Dr. Mayo from Rochester Regional. And thank you, media, for being here for this important message. We are all tired of COVID. Unfortunately, COVID isn't tired of us. As all of us know, it's a very contagious virus. It takes advantage of every opportunity. In the United States, we've hit over 100,000 cases. So this isn't just a regional problem, this is a national problem. We've seen a worrisome spike in cases in Monroe County, the Finger Lakes region, and in the southern tier. Our doctors and nurses have learned a great deal about how to care for COVID patients over the last 8 months. We have had more effective treatments, and fortunately, our fatality rates have decreased. I worry, however, that this success has led to us lowering our guard because the illness seems less dangerous than before when it first occurred. So I want to caution everyone, as COVID cases go up, it's inevitable that more patients will require hospitalization and critical care. And unfortunately, more patients will die. Even patients who aren't hospitalized can suffer serious long-term effects to the lungs, the heart, and other organs. It's important to remember that what each one of us does today affects what happens tomorrow. Every individual's effort to reduce the spread of the virus improves the overall health of the community and allows our health systems to take care of you. Simple precautions, as Dr. Mendoza and County Executive Bello said, of masking, social distancing, and hand sanitizing have a huge and very positive effect. As has been stated, this brought rates down here over the summer and allowed us to reopen workplaces, schools, and businesses. At our hospitals, the reduction in cases enabled us to care for more non-COVID patients and to restore limited in-person visitation. Reopening our community requires us to maintain and double down on those safety precautions. We all want to go back to quote unquote normal, but it's time to get our second wind and fight through the COVID fatigue that we're all suffering from. As care providers and the largest employers in our region, UR Medicine and Rochester Regional Health are redoubling efforts to keep our patients, visitors, and employees safe. We continue to require masking and social distancing in our facilities. Clinical staff members wear not only a mask, but eye protection when they're at work. We've seen that the biggest risk to our staff occurs during meal breaks. And as such, we've dedicated large meeting spaces as dining areas, allowing staff members to maintain adequate distance from each other while taking their masks off to eat. We provide flu vaccinations to all our employees, and we encourage everyone in the community to get the flu vaccine. This will help reduce the total amount of illness in our community this fall and winter, which are always the busiest times for our hospitals. We are just weeks away from Thanksgiving, when all families want to be together. So we ask that you take precautions, even with family and friends. This illness is hard to contain because people who feel just fine can infect others without knowing it. When you are home, wear a mask when visiting with anyone from outside your immediate family. Consider visiting over FaceTime or Zoom instead of being together. And if you do plan a family gathering, keep the numbers as low as possible. And keep some distance from each other while eating. And keep your mask on while not eating. Think of other ways to adapt your holiday routines. Shopping online is much safer than shopping in crowded businesses. We all want to keep our community open, and to do that, we need to keep it safe. As medical professionals work hard to control the pandemic, we ask for your help as we head into this holiday season. And I'm confident from what the community was able to do this summer that we can do it again. Protect ourselves, protect our families, protect our community, so that our hospitals don't get overrun with sick patients, which keeps us from taking care of patients with non-COVID illness. Thank you. Dr. Mayo? Dr. Mayo, I think you're muted.
Thank you. Thank you, Dr. Apostolakos, Dr. Mendoza, and County Executive Bello. As always, it's a pleasure to have a shared voice with the four of us to lead our community through these challenging times. I'm grateful for the many individuals over the last many months, both healthcare heroes as well as our community members who have taken measures to curtail the COVID virus. I think the simplicity of the preventions is sometimes a stumbling block because it just seems so simple to take a sneak without your mask on or to forget continuous and regular hand hygiene. But all of these small steps, however simple they are, remain the most potent way to control this virus and to stay healthy. As has been mentioned, we are definitely seeing an increase in cases over the last few weeks. Within Rochester Regional Health Hospitals, we've had a 5-fold increase in inpatients with COVID-19 since the middle of October. So this is real and it is happening. So all that we can do every day matters and makes a difference. We each remember that the wave earlier this year of illness lasted a few months, and the duration of this wave and the severity of this wave is a story yet to be told. So now is our opportunity to make that story and to impact it as positively as possible. So please join with all of us in curtailing this virus. Similar to the University of Rochester Medical Center, Rochester Regional Health Hospitals have taken measures to protect our patients, our visitors, as well as our employees. Those protective measures at times feel like an impediment to the level of socialization and visiting and interaction we would like, but they remain necessary. And if the viral spread continues to accelerate, we will be considering further measures to protect our employees and our patients through visitation restriction. So help us all together make this a positive story in a difficult circumstance. And I'll turn it back to you, Mr. Bello.
Actually, I'll take over from here. Thank you, Dr. Apostolakos and Dr. Mayo. I want to end on somewhat of a positive note. There are things that are working. We have seen virtually no transmission within a K-12 school building in Monroe County. Schools have followed very carefully developed plans that have reduced the number of people in buildings. They have set up protocols to ensure social distancing and masking, among other safety precautions. A huge amount of effort went into creating these plans, and it was chaotic at first, but it is clearly working. We are looking at how those might be adapted to other institutions and businesses as we go forward. And we know, after the contact tracing that we've done involving nearly 20,000 individuals, that masking, physical distancing, and hand washing make a huge difference. Without a vaccine, these are the ways that we stop this infection in its tracks. As the county executive said, we have the power to beat this, but we need that willpower to beat it as well. And so with that, I want to thank the county executive, thank my colleagues, Dr. Apostolakos and Dr. Mayo, for being here today. And I want to open up the floor to the media for questions.
We'll get started with Noelle Evans from WXXI.
Hi, I hope you can hear me. So my question for you is there any potential of lockdown measures ahead of us and any talk of more rapid testing?
So I can speak to the talk of lockdown measures. We're looking to avoid that, and that's the purpose of today's press conference and this briefing. We're seeing this increase in the positivity rate countywide. We're also seeing it across the country in different places. And what we're trying to do is ask for the public's participation. I mean, look, I care too much about the health and safety of this community for us to give up now. We don't want to go back. And the other piece is we know a lot more about the virus today than we did back in March when it required the full shutdown. So one of the things Dr. Mendoza just talked about was how the schools are operating. This has been a really great experience in terms of mitigating the spread of the virus at schools. They have worked incredibly hard and in many ways have been an example for the rest of the community on how to prevent people who are sick from spreading it amongst these when you're in a congregate setting like that. So I think we have a lot of examples that we can learn from how they've treated this. So we need to have a call to arms now and a call to action to the community. What we do today, action we take, to Dr. Mayo's point about how the future of the second wave hasn't been written yet, the story hasn't been written yet. What we do today is going to impact where we are in a few weeks. So as we're looking out to Thanksgiving, that's just in a few short weeks from now, what the health of the community looks like then, what the community spread looks like, our hospitalizations look like, our ICU numbers look like around Thanksgiving is directly correlated to the actions that we all take today. And I know that the COVID fatigue is set in. We don't really want to wear our masks anymore. We don't want to have to stay socially and physically distanced from each other anymore. But the trade-off for being able to wear our masks and physically distancing is that we're avoiding those shutdowns. We're staying open. We're still able to go to a restaurant. We're still able to go shopping. We're still able to do those things that have opened up to date. And we want to continue to see that happening. But there's trade-offs. And the trade-off is we have to follow the advice that the doctors here had offered. So there's no imminent shutdown, but power's in our hand. It's in our hand to look at where we think we want to be at Thanksgiving and make those adjustments today. And then I could turn over to Dr. Mendoza can talk about testing.
Thank you, County Executive. So the currently available rapid tests, and we have them here in the county and we have them across the community, they are best intended for diagnosing people in whom we have a high suspicion for COVID-19. So people who have symptoms or people who have had a close contact. Because of the volume of tests that we have available right now, we are utilizing the available tests primarily to investigate clusters in homeless shelters or in congregate settings or in nursing homes, because that is the best way to utilize the available capacity. Now, as we go forward, if we can obtain even more tests, there are maybe ways that we can utilize them for surveillance purposes, but that would require many, many more tests to have on hand, and that a lot of people will need to get tests very frequently. So for surveillance purposes, we still recommend the conventional PCR test, but the rapid test will be available for people when we're trying to evaluate a positive case who we think has the infection, so that we can start the investigation and contact tracing more quickly.
Thanks, Noelle. Next is Jennifer Lukey from WHEC.
Hi, Dr. Mendoza, let's talk about Thanksgiving. People are making plans right now. What is your suggestion to folks about those Thanksgiving dinners? Whether they should just be people inside your house, whether some families okay, what are your recommendations?
Am I muted? So this is a very personal choice. I think everybody has to look at their individual circumstances and try to figure out what risks they're willing to take. I think that risk calculation will vary depending on your own circumstances and all of the details in everybody's individual families. What I will say is that the larger the gathering, the more risk there is. I think that's the number one consideration is the number of people that you invite to the table. The second consideration is, the individual circumstances of all of those people. The more you invite people from outside your household, the greater the statistical chance of inviting somebody in who inadvertently may carry the virus and not know it. That being said, I think it's reasonable that some people will want to take some risks, knowing full well that the alternative is not one that they're willing to tolerate. So if people are willing to have larger gatherings, I would strongly encourage you to use your masks, keep distance whenever possible. When you're seated at the dining table, try to spread out as best you can. But when you're not at the table, put your mask on whenever it's feasible. I understand that these are hard times, but at the end of the day, I think everybody has to figure out what level of risk they're willing to accept.
And speaking of travel plans, we have been getting pounded, as I'm sure you have, with questions from people about these new travel restrictions, having to get a test before you come in and then 3 days after. I mean, what is the bottom line for folks here? I mean, a lot of folks aren't going to be here for 2 weeks if they're coming in for Thanksgiving. They're here for 3 or 4 days. Are you being asked to enforce that in some way, and how are you handling that?
Well, the guidelines do indicate that the local health department is responsible for enforcement. So we are working on that plan right now. But as I've said before, our goal is really not about enforcement, it's about education. And having everybody understand as best as possible what level of risk they literally bring to the table. So for people who are traveling out of the area and planning to return, my suggestion would be schedule in advance within those first 4 days upon return to our area to have your test done at MCC, for example. And in that way, you can plan ahead and not have to encounter, what I anticipate will be a large surge in demand for tests in those days following Thanksgiving. So planning ahead, I think, is the most important thing, and hoping that everybody will do the right thing.
Thank you, Jennifer. Andrew Vanis from 13 WHAM, you're up now.
It's actually Tanner now. We switched up assignments. But Dr. Mendoza, tell me, with all these new cases, do you know how many of these are asymptomatic, or are there a lot of people out there who are very sick, like early on in the pandemic, or I guess what are you seeing in terms of people who are really sick and people who are not sick?
So that's a good question, Tanner. I'd have to look at the data more closely to give you a specific number, but between 30 and 40% of people are asymptomatic, which in my view is a large enough number that we all need to maybe look inside and say, perhaps I could be one of them. And whenever we go somewhere, not just thinking about when we're wearing our masks, but I think we also have to think about when we take our masks off, whether it's for a mask break or whether it's to take a sip of coffee or whether you're sitting down with another individual. We often think about, making sure that we remember our masks, but I think the next step is to be thoughtful about when we take them off. Dr. Apostolakos and Dr. Mayer both spoke of lunch breaks. And we often let our guard down, because we have to take our masks off to eat, but we don't take that next step, the very unusual step of thinking, can I have lunch alone? It's not something that typically people want to do, but unfortunately it's something that we need to consider. So when you take your mask off, it's just as important as when you put your mask on.
And you talk about knowing more, obviously, this time around? I guess kind of a two-parter. I guess what gives you some confidence heading into a second surge in terms of what we know now, and maybe what concerns you the most in terms of what we still don't know?
I think the answer to both questions is that we have a better sense of the positivity rate in the community. You'll recall in March and in early April, we did not really know what the positivity rate was in the community because we weren't testing enough. And so we were seeing rates in the 14% and 15% range, but that's because we weren't testing enough people. Now what we know is both reassuring and concerning. We are testing in high volumes, and we know that that positivity rate has been relatively stable as an increase over the last 2 weeks. It has not stopped going up, no matter how much or how little we're testing, and we're, in general, testing far more people now than we were even weeks ago. So the percentage of people who are getting a test that turn out to be positive is increasing. And so, like I said, that is good news in that now we know what the number is, and it's bad news in that we know that it's high and increasing.
Thanks, Tanner. Patty Singer from Minority Reporter.
Hi. So if we have potentially 30% or 40% of people are asymptomatic, and then we also hear we're all in this together we'll get through this. Can you just clarify then of having individuals assessing their own risk of being in a gathering or Thanksgiving when they're going to come back to work, they may come back to school, they're going to come back to us all being together. How do we have individuality, yet we have this, we've heard for months about this shared responsibility?
I think the shared responsibility comes with taking precautions. It's recognizing that any of us could be the problem. And so for that reason, we all want to do the right thing, not only to protect our loved ones, but to protect our neighbors and strangers. And I think that's what it means to know that we're all in this together. We all have to do our part to keep one another healthy and safe.
With the increase in quarantines and people in isolation, what is the status of the hotels that we had talked about earlier in March? I mean, how many people do we have in them? What is happening if the hospitals need some help with the convention center or some other field hospital? Where are we with those situations?
Well, we're not at the point of needing a field hospital, which is why we're having these conversations today, trying to avoid that, just like we did earlier this year and flatten the curve. We still have relationships with area hotels to be able to quarantine people if necessary, if they don't have another place to do so. And that all gets managed between our Department of Health and the Department of Social Services. So when you test positive and you're in that situation, that's a conversation that you would have with the Department of Health, and then they would make the proper provisions to help you.
All right, Wendy Wright from Spectrum, you're up.
Yes, hi there. Had a question in regards to the rapid testing and how well they work. I was talking with someone in a nursing home who had one that is called a BD Veritor Plus Analyzer. I don't know if that's what they're all called, but how reliable are they, and do they all work the same? Because initially I had heard that they don't necessarily have the best results, but then I'm hearing now that they are fairly well reliable. What can you tell me about that?
Dr. Apostolakos or Dr. Mayo, do you want to take that one?
Sure. There are many different platforms that have been released, and quite frankly, they all haven't had the same testing that would happen at normal times. So we're learning more as these things are being rolled out. I can tell you that the rapid tests are not as accurate as the tried and true PCR, which takes longer. However, as Dr. Mendoza said, when you're looking for outbreaks and you want to quarantine people who may have been exposed, rapid tests that give you information sooner are better than waiting a day to get the best test. So what we generally recommend is if you use a rapid test like that, when you're looking at an outbreak, that you confirm any positives that you get with the rapid test with the PCR test. And you'll see, and this is what's happened, you'll see this in football and other sports where coaches were positive, then they have 3 negative tests in a row. It's because they used a rapid test that was less accurate and then confirmed it with the PCR, which didn't confirm it. But waiting a day when someone may have exposed 10 people and letting them expose others isn't the best. So that's where the rapid tests come in.
Okay, because the way I understand it is they're being used in all of the nursing homes in our area right now.
I'm not sure that's true, Wendy.
I can tell you it's not true for the URMC associated nursing homes.
Yeah.
Okay. And then the other thing is, if the schools are doing such, a great job, most of them anyway, in the community, why can't those same principles be used in the Rochester City schools?
Well, every school district has to assess its own individual needs and its ability to make those accommodations. And there isn't a one-size-fits-all approach, I can say, across the county. Some school districts have in-person learning options every day of the week. Other districts have a combination of in-person and remote. And the city school district is fully remote. And I think that depends on a lot of factors, including transportation, size of classrooms, class sizes, the availability of teachers, administrators, things like that. So you'd have to talk to each one of the individual school districts to understand the decision-making process behind each one of those. But what we have seen inside the schools that are open to in-person learning is that they've done a really great job at keeping the disease from spreading. Obviously, we see a lot of announcements, and I'm really glad and grateful for the transparency that the school superintendents have engaged in making announcements when there are positive cases and engaging with families. But there really has not been a lot of evidence that it's spreading within inside the schools. People are getting them outside of the schools. And then before I move on, though, I do want to just touch upon something Patty Singer said earlier. Your question about how we all have a role to play. We're in this together, but a lot of us are asymptomatic. So that's true. A lot of cases are asymptomatic. There's a lot of people who could be carrying it and don't know they're carrying it. But that also underscores why I said at the beginning of the press conference, my remarks, that the MCC site is critically important to us. They have tested now, I think, roughly 80,000 people. They can do 700 people a day. And that helps us with when you're looking at community surveillance to find out what is that positivity rate, to get those positive cases as soon as possible so that you can go home and self-isolate and quarantine. So I just would encourage everyone listening to this. It's very easy to do. Even if you're traveling from outside of town and you're coming in and you need to get that test done, just schedule the test. It doesn't take long to do, and generally testing times and dates are available within just a day or two.
Okay, our final question comes from Atyia Collins, WROC.
Good afternoon, everyone. I just have one question. Some of them were asked already. I know, Dr. Mayo, you talked about the Rochester Regional Healthcare System seeing a 5-fold increase in patients since the middle of October. And I know before we were talking about the availability of equipment and making sure that all of our hospital systems had enough ventilators, room, and other equipment to treat these cases. Are we at the point where we are looking at our equipment levels or getting more equipment, or where are we as far as where you guys think we are as far as having enough to handle a second spike?
Sure, I can respond first to that. We have a daily accounting for our equipment and have ever since March. That hasn't stopped. We account for all of our different types of personal protective equipment, from masks to gloves, by size, by manufacturer. It's quite a detailed spreadsheet that is tallied every day. We also purchased a significant number of ventilators early in the summer in anticipation of larger numbers of critically ill patients, so those are available to the community. And so I do not at this point see any concern relative to supplies or equipment. So that's a reassuring thing for sure, and we are prepared for larger numbers of ill patients. but the better we control it, the better this will be for everyone, no matter what.
Yeah, what Dr. Mayo said for Rochester Regional is true for URMC. We have right now plenty of PPE, plenty of equipment to take care of patients. However, the steep increase in number of cases, and at Strong, we doubled the number of patients we have, and in our whole organization, we have 4 times the number of COVID patients we were caring for just a few weeks ago. What the concern is, if that continues, the way we make capacity and the way we made it before the first surge was to limit elective surgeries. And so patients in the community had to put off things that they felt they needed, but technically, medically were elective. And what I do worry about is if we don't go back to the same practices we had in the early summer, we may have to start limiting elective surgeries to make capacity for sick patients from COVID. So it can eat away at the amount of healthcare we can provide to non-COVID patients.
Thank you.
All right, with that, I want to again thank County Executive Bello, Dr. Apostolakos, and Dr. Mayo for joining us today. Thank you very much, and have a good day.
Thank you, everyone.